Your arteries aren't lisinopril deficient. Medication saves lives, but the villain behind stubborn blood pressure is often elevated insulin levels or hyperinsulinemia. So if your insulin levels are running high all day, this tells your kidneys to hold sodium and water, and it stiffens your blood vessels and pressure climbs. So here's the picture. Grazing and eating refined carbohydrates causes your insulin to stay high. When your insulin is high, this causes your kidneys to hold on to sodium and your vessels stiffen, which then turns the blood pressure up. So if all you do is treat the number without lowering insulin, you're mopping the floor with the faucet still on. So let's look at angle number one, your kidneys. High insulin makes the kidneys retain salt. You carry more fluid, which causes your pressure to rise. Angle number two are the vessels. Chronically high insulin levels thicken and stiffen those vessel walls. Stiffer pipes equals higher pressure. And then finally, the third angle is meals. Every time you snack, even a healthy one, nudges those insulin levels up again. So 6 small meals equals 6 little pushes on the pressure pedal. So here's our action steps, 2 to 3 steps with absolutely no math involved. Step number 1, 2 real meals, no snacks, protein first. So we want to aim for about 30 to 60 grams of protein per meal, things like steak and ground beef, salmon, eggs, and add enough fat till you feel satiated or satisfied. Carbohydrates near zero if you're low carb or carnivore. And fewer insulin spikes, this equals kidneys letting go of sodium. So the less insulin spikes you have, the kidneys can release that sodium, release that water, and the pressure eases. Step number 2, walk 10 minutes after meals. A short walk lowers post-meal glucose or sugar and your insulin levels, gently relaxing the vessel tone, those blood vessel tightness or muscle tone. And no gym is required to do this. Step 3, replete those minerals. Many people are potassium and magnesium low. They're insufficient. Food first, things like meat, eggs, seafood, if you include plants, avocados, and leafy greens. So focus on food first, then consider supplementation. You want to consider magnesium about 300 to 400 milligrams per day if your clinician agrees. And these minerals support vessel relaxation. So if you snore, wake up unrefreshed, or feel sleepy driving, you want to screen for obstructive sleep apnea, or otherwise known as OSA, or sleep apnea. Nighttime airway collapses spike the blood pressure dramatically. So treating that apnea often drops the numbers more than a second drug will. And let's talk about some labs that help to clarify things. So you want to ask for fasting insulin and a HOMA-IR score, which is a score related to your insulin resistance. And you want to see if insulin is the basic driver of your high blood pressure. Basic electrolytes help tailor minerals. And if symptoms fit, you want to get a sleep study. So medications stay on board while you make changes, but you and your provider adjust as numbers improve. So seek care now for things like chest pain, severe headaches, vision changes, shortness of breath, neurological deficits, or readings in hypertensive crisis ranges, big high numbers, things like 200 over 100. And then remember the chain. Grazing equals high insulin. High insulin equals holding on to sodium and stiffer vessels, which then in turn leads to those higher blood pressure readings. Make sure you're cutting the grazing, you anchor meals with protein, and you walk about 10 minutes after each meal. So grab my quick blood pressure, quick start worksheet in the first comment or description, and make sure you comment worksheet, and I'll be happy to get that out to you. So thanks for watching. I hope you now understand better how to reduce that blood pressure and how to do it naturally.